When a friend is facing a major illness like cancer, you want to help. But many of us don't know what to say or how to be helpful. So sometimes we say too much and sometimes we don't say anything at all. The Fox Medical Team's Beth Galvin has some tips on how to talk with someone who's going through a medical crisis. It's hard to find the right thing to say to someone when they're sick, and sometimes in trying to say the right thing, we say all the wrong things. So we spoke to a clinical psychologist who works every day with patients at Wellstar Kennestone Cancer Center about what to say and what not to say when someone is facing a serious illness. What do you say when someone you know and care about is battling cancer? Dr. Jennifer Kilkus, a clinical psychologist at the Wellstar Kennestone Cancer Center in Marietta, says many people don't even know where to start.
They don't know that it's okay to just say, this is hard and I don't know what to say, but I'm here. You know, what do you need?
And Kilkus says, be gentle.
Be mindful of the fact that you're talking with somebody that's going through something that's very scary and uncertain.
There are a few things not to say to someone facing a serious illness. Kilkus says you don't want to shrug off what they're going through, saying something like,
everything's going to be okay, or it's really not that big of a deal, or at least you don't have to go through chemo. Like if somebody's getting radiation or surgery, it's sort of that dismissive, well, it could be worse.
And avoid saying, I know how you feel, because really, you don't. Also, don't compare your last medical issue with what they're facing.
Don't share the stories about your grandmother that also went through cancer, but then she died. You know, that's not a helpful thing to tell someone who's in the middle of their treatment course. And I think a lot of people tell stories like that because they want to connect somehow and say, I understand what you're going through, but that might not always be helpful to somebody who's in the middle of treatment and in the middle of that fear.
Finally, Dr. Kilkus says, don't ask or share your theory of why someone has gotten sick.
Saying if you had only done this, then maybe this wouldn't have happened to you. That's actually fairly common with the patients that I work with. What people need to hear right now are messages of support.
So be there, be gentle, and Kilkus says the words will come. And Dr. Kilkus says one of the best things you can do is keep asking how you can help, because the need changes over time. And if you don't know what to say, she says, just say that. Just don't ignore what's happening. For the Fox Medical Team, I'm Beth Galvin.